Good morning, and thank you for joining the South Georgia Healthcare Group's webinar series. My name is Amy Jones, and I'll be the facilitator for today's webinar. This is our third portion of our webinar series, and today we're going to be discussing diversity, equity, inclusion, and also safety and privacy protocols in healthcare. Before we get started with our panelists, I want to let you know that this recording or this webinar is being recorded, and we will share that on our YouTube page, which is under the WorkSource 7 Georgia. We also have a Q&A feature enabled, so if you have any questions during this session, then just put those questions in the Q&A, and we'll get to that towards the end of our 30-minute session today. Also, in the chat feature, you'll see the links to our two panelists' websites and also our website on the Regional Commission. And the last thing is that we have a QR code that will come up at the end of this session, and that'll take you to a survey. And we would appreciate if you would take a few minutes and take that survey and give us some feedback. So we'll go ahead and get started today. So today we have with us Ms. Jill McIntyre. She's with Tift Regional Medical Center in Tifton, and we have Mr. Greg O'Quinn with Memorial Satilla Health in Waycross. Ms. McIntyre, will you tell us a little bit about yourself?
Good morning. My name is Jill McIntyre. I am the Director of Diversity, Inclusion, and Wellness here at Tift Regional. I have been with our organization for 20 years, November 5th. My background is nursing, orthopedic nursing. I worked in IT and recently been responsible for the wellness and safety of our employees.
That's great. Thank you. Mr. O'Quinn.
Good morning. My name is Greg O'Quinn. I'm the HR Vice President and Ethics and Compliance Officer at Memorial Satilla Health. I've been with the organization here. January will be 10 years. And I'm responsible for human resources, employee health, and our volunteers and our auxiliary here at the hospital. Okay,
great. Well, thank you for that. We'll go ahead and get started. Again, we're having our discussion today. This is our third webinar in this series. And we want to really kind of get into what it's like to be in a workplace culture, and that includes the diversity, equity, and inclusion, or DEI. So I would really like to start with what the basics are and define each of those. So Ms. McIntyre, if you want to just start, and then Mr. O'Quinn, you can kind of jump in at the end on these. What do you think about when you hear diversity?
Diversity, what I think about is what makes us all different. All those unique perspectives, thoughts, that is how I define diversity. And as far as inclusion, taking all those different perspectives and making sure that each individual feels welcome and respected and supported. And as far as equity, just making sure that we meet each employee where they're at. Some employees will require different things, so we just have to make sure that we're fair and impartial with that.
Great. That really helps a lot. Mr. O'Quinn.
Yeah, I agree with what Jill said. I think it starts with diversity, and I think that means more than what we can see and what we look like. I think that's diversity in our backgrounds. I think that's diversity in how we think. And that is very much needed in a large organization, because we always try to mirror our community. And I really think we do a great job of that here in Waycross. To be diverse and to be like our community. And then also, as far as inclusion is concerned, we're a large organization here. Our hospital is big, but then we're a part of a much bigger organization throughout the United States. We want to be inclusive of all people because we take care of all types of people here in our hospital. And we want our employee population to be like our community and to mirror that. And so we have to be inclusive of all folks, all ideas, and all backgrounds. And I feel like we do a really good job of that here. And that helps us be successful, because if we all look the same and we all thought the same, we probably wouldn't get in a place where we're moving our organization forward.
I think that's a good point, because you want to not just be stagnant in your thinking, because then you'll die. You know, you as a business, you have to continually grow, and that's opening your mind to those things. So as we're talking to these students, maybe haven't been in the workplace and maybe have not been into a large organization where DEI is a very large focus, what are some basics that you want to share with them as they enter the workforce, and how to make that transition, and how to make sure they think about others and not just themselves, and be open to those new ideas and awarenesses? What are some things that you want to share in your training that you've had?
So here at TIFF, it's very important that we define diversity, equity, inclusion as new hires when we come into the organization. Because understanding those concepts, and like Greg said, it goes beyond what you can see about an individual. Mm-hmm. So it's very important that we level set with all of our new hires to define those different terms and know that it's okay to think differently. But how do we take those differences and not only interact with our patients, but also our fellow coworkers too as well? So we level set in the very beginning in our orientation. And then as far as our organization, this is kind of a journey. So every year we have learning opportunities for our employees as well, to not only recognize our differences, but how we are able to communicate those differences and work with our fellow employees and patients too as well.
That's great. Thank you. Mr. Quinn?
Yeah, again, I would agree with Jill. I think she nailed it. Workplace, I would say a workplace is different than being in school. The workplace is more of a melting pot, I would say, of combining different people, different backgrounds, different religions, different races. And I think in the workplace, we just need to get the job done. And being a part of the same team, whether you look the same or whether you think the same, is kind of secondary in some instances, because in healthcare, in a lot of cases, you may have someone's life in your hands. And so you want to work as closely with that coworker, that team member as you can. And with them, maybe you having different backgrounds, you really set that aside for the one common goal, and that's taking care of that patient. And so I really am proud of our hospital and the diversity that we have, and that I feel like we are inclusive of all people and all backgrounds. But I would absolutely agree that a workplace is different from going to school, and that people are much closely they work much closely together, and they build different kinds of relationships because of the nature of what they're doing and how they're supporting each other. And so that kind of goes on the back burner because you've got a job to do. And whether you have a different background or whether you look differently, that doesn't mean you can't work together to take care of our patients and to get the job done. And we do that very well here.
When you think about the diversity, especially what students deal with in school and in like K through 12, they're with their same age group all the time. But when you get into the workplace environment, diversity includes age. And so when you're dealing with people who maybe are 50 and 60 and you're younger and they don't think the same, that doesn't mean they think wrong. You can really learn a lot from somebody who's older, who's seasoned, who's been there. But then on the other hand, the older people can learn from the younger people with those new ideas and that fresh talent. So that's part of the diversity of really kind of bringing in just those different levels of experience as well. So, but I think when we move on into a healthcare setting and they come into that environment, let's talk a little bit about safety, because there's safety in working with the patients and there's safety employee to employee. So let's talk about a little bit about what it means as far as safety with your patients. Mr. O'Quinn, if you want to start.
You mean from just a safety perspective of keeping them safe when they're in the hospital and making sure we provide good coverage? Yeah.
Just those different protocols.
Right. There's a lot of new things in the healthcare world, I would say, over the last 2 years that I've never dealt with in my previous 7 years, right?
Yeah.
It's been a different, challenging work environment where we've had to make a lot of adjustments and be flexible to make changes very quickly. During the height of COVID, we had a lot of safety protocols in place. We screened everyone that came in the hospital to ensure that they were not COVID positive or that they did not have symptoms. Same with our employees. And then we provided our employees with all of the PPE that was necessary for them to do their jobs, and to maintain a safe work environment. And we did, just providing the materials is one thing, but providing them with the training so they understand how they're supposed to wear, doff, and don that equipment, or that PPE, is very important, to maintain their safety. And as you guys can imagine, in the very beginning of this, we had a lot of really concerned and apprehensive employees because we did not know enough about this virus. And so they were very, very concerned about treating these patients in the beginning. And so there was a lot of things that were done to make sure that we were able to maintain their safety, but providing them with the right equipment, providing them with the right training, and then educating them on the virus and how we were going to handle it here at our facility.
Ms. McIntyre?
And I'll piggyback off of what Greg said too as well. Coming into an organization, there are a lot of requirements, and sometimes you don't know the why behind those requirements. And you may want to say, why are we requiring this? Why are we requiring this? It goes back to safety. Like Greg said, when COVID hit, we had some of our male employees had to cut their beards to accommodate the N95 mask. So understanding the why behind that, to get a good fit, to get a good seal so you would not contract COVID. So there are a lot of regulatory things that we have to follow that sometimes make us kind of say, why do we have to do that? But at the end of the day, it's not only for the safety of our patients, but also for our employees too, as well, to keep a healthy workplace. As well as, I know we have a lot of new orientees. There's a lot of things that we require. We ask for a vaccination record, medical history, all that information that's being requested is not because we're trying to dig into anybody's personal life, but it's about the safety of our employees. And that was very readily, I know our executive team was very hands-on in dealing with COVID, just making sure that our employees were provided the right PPE, and just making sure that we had all the tools that we needed.
That's a good point, because it's not just, I know COVID is a large focus right now, but even prior to that, and as we go further past that, the safety of your workforce is going to be key, because they are dealing with the hospital setting. They are dealing with illnesses that are coming in. You want to make those patients well, but then you want to keep your employees safe too. And so, I think that's a good point that you made, in that when you're doing these things, not necessarily understanding the why behind it isn't the focal point, but if you just realize that it's for the safety of the workforce, I think that's really important. So when we talk about privacy in healthcare, there's a lot that goes on, because those people come in and learn a lot of information about those patients and about their histories. What are those protocols that you really want to focus on when they come into a healthcare setting about keeping things private? Mr. O'Quinn, if you want to start.
Sure. I just want to add one thing Jill said earlier. She talked about explaining the why. That is extremely important. People still may not agree with you, but if you explain to them why we're doing things and it's related to safety reasons,
right?
People can understand that. They may not agree with it, but they understand why we're doing it. Privacy is a huge deal at any healthcare organization. Our patients expect that. They expect that their health information is going to remain private. Right. We do a lot of training when employees are hired as a part of their new employee orientation and their onboarding related to privacy, what information they can access and what they should not. We try to keep it very, very simple, right? If you do not have a need to know as a part of your job, then you should not access that person's medical information.
That's good.
I'm in human resources. I do not even have access to our patients' medical records because there's never a job-related reason for me to do so.
Right.
Now, our employee health coordinator, she may have a different level of access, so she may have to access records at times. But, it's our expectation that when our patients come into our hospital, that their medical information is protected, that we do not share that outside of the appropriate channels, and that our employees do not access records unless they have a work-related reason to do so. And we really make that very clear in our new employee orientation, and we do that with our annual privacy training as well. And so it is something that's very much in the forefront for our employees, and they know what that expectation is.
I agree as well. What I have always, when we have went out to schools, it's very different working in healthcare, and privacy rules versus school. In school, you can gossip. Did you see such and such at the store last week? But when you're in healthcare, just mentioning that someone was in the hospital is a violation of privacy. So it's just something simple as that that can cause a HIPAA breach. So we have to be very mindful that it's kind of like Vegas, what happens at the hospital stays at the hospital. So that's kind of how I just put it, where the students can understand it's not a gossip column, or it's not where you can say that even if it's a family member, it's that protected, and our patients expect that out of us in healthcare.
Yeah, and go ahead.
I just add one thing, a funny example. When I first started working here a long time ago, I had an aunt that reached out to me and wanted to know a specific member of their church congregation was in the hospital because they wanted to put them on their prayer list.
Right.
Reasonable request from my family member's perspective, but from my perspective, I absolutely could not release that information. I could not even look because of my job. So I think the public don't really understand what kind of guidelines and rules that we had. But Jill said it, you can't just pass somebody in the hallway, and if they're in the hospital, then go and share that with someone else. It is that protected. And so it is more protected than I think most people think.
Yeah, and that's a good point, because if you're working in ER and then you see your best friend's parents come in the hospital, you can't text them real quick and say something. It's your personal thoughts and emotions have to be removed from it, because it is a protected environment. And even so, when you are discussing patient files, as far as like the nurses, how do they discuss? Do they say Miss Brown, or do they say patient 2? Or, how do they discuss those? Can they not say names?
They can, if they have direct care with that patient, then they absolutely can. But you want to do that in a private area. I will tell you, a lot of our biggest HIPAA or privacy complaints come from caregivers talking in the hallway and someone overhearing that conversation. And so they have to make sure they do it in a very private way, and do it in a way where they're not going to be interrupted, and someone's not going to be able to hear their conversation.
And I would like to add, I know we talked about patients, but from employee health standpoint, employee files are just as protected as the patient. So what I know about employee, nobody else knows about it. And it's only on a need to know basis. So not only are we protecting the patient, but also employees, their information is protected as well.
I think that's a really good point. We kind of talked about that a little bit on our one of our other interview processes, I think. But that information, when you come in and fill out your application, you want to be honest about your background, about, your employment history, and then know that that's not going to be shared and discussed, not only amongst administration, but amongst other employees, and that privacy is very important. And people do tend to talk, but you really need to keep your information and obviously other people's information private. So we've got a couple of questions that have come in, and I want to share with those. So this one goes back to DEI, and I know you talked about the training that you have in privacy, and you have some training in the safety, but do you offer training to new and your existing employees on DEI?
So here at TIF, we do offer training and orientation when you are a new hire, and also we offer orientation to our leaders as well as our staff as well yearly.
Okay, so you do that yearly.
We do the same. It's a part of our new employee orientation. We go through diversity and inclusion as a part of our code of conduct training. And then our existing employees have that refresher training once a year that they're required to do. And we talk about it pretty lengthy in our new employee orientation. And then also myself and our chief operating officer are a member of our diversity, equity, and inclusion council for our division within HCA. And so we have a monthly meeting where people like me and our COO within our division have a meeting. We talk about our DEI efforts and our community efforts as well.
You know, I think it's important when you think about like those committees should be diverse as well. You have to have the important leadership. But when you think about like the board members of a city, if you have everybody of the same race, of the same age, and of the same gender, well, you're not having various thoughts and ideas come in. So it's really a focus on how to move the organization forward by having that diversity and those different ideas and talents and beliefs. It's good to know that you guys offer those trainings on an annual basis, because, you know, those refreshers, and that's something that you have to really be aware of and think of. It doesn't always come natural to everybody to really make sure you're focusing on not having those biases. So the next question we have is, does your organization have employees complete surveys or another method to ensure that employees feel as though they're being treated with inclusion and equity?
Yes, so we have employee engagement surveys that we send out. I believe it's yearly, but don't hold me to that. But we do have surveys that employees can come to my office. I was actually located off-site, but now I am on-site. So employees can come if they have any issues. We also have a council too as well that's not only made up of some executive members, but we have board members and also frontline staff. So we use that as an opportunity to make recommendations to our organization. So that's different perspective. And like you mentioned, not only do our diversity our council look different, but we're taking different perspective from different job areas too as well. Right. Because I'm a nurse by background, and maybe I favor the nurses, but respiratory or lab or environmental services may have a different perspective. So we do have that council to help with that. But to go back to the question, we do have employee engagement surveys and also patient surveys too that help us as well.
So same thing here that Jill mentioned. We have a quarterly employee engagement survey. We actually just finished one the 1st of November, and we'll complete all of our action plans that we have as follow-up by November the 29th. And that is one of the focus areas on these surveys, because ours we do them quarterly, so they're usually about 6 to 8 questions. They're not going to take the employee a really long time. It's for us to focus on things like communication. Diversity is one of the areas that is an area of focus. And then also what Jill said too, definitely rung true to me, that we have patient surveys as well. And that is something that we ask our patients is about their care and about the demographics of the people that are taking care of them, and did they feel comfortable and they feel like we have a diverse workforce. And so we not only ask our employees, we ask our patients as well. That's great. It's a goal, and it's something that we're working toward. I wouldn't say that we're where we need to be now, but like Jill mentioned, we have a diverse DEI council. And the point that she made about it not only being diverse is how we look, but where the work is very important, because I'm biased to our employee health nurse too, because she works for me. But there's a lot of other jobs in our organization as well that need to have a voice also. That's
right. And I think that kind of goes back to when you have the interview process, we might interview with the managers, but then you have that interview with your peers, because they've got a different perspective and they want to know different things about making sure that it's going to be a cultural fit. So we only have time for one more question. So the question is, what does a new employee do if they recognize that individuals they work with are not practicing DEI in the policy, following that policy?
So we have a lot of mechanisms in place for them to report. Of course, we would always encourage employees to use their chain of command. That's the standard HR answer, guys. I'm sorry, that's just the way it's going to go.
Right.
Chain of command first, user, supervisor, manager, and director. And if they don't feel comfortable doing that, or those people may be a part of the issue, then we always have our HR representatives that they can come and speak to. And we have an anonymous line that employees can call if they don't feel comfortable speaking to someone in person. Then they can call our anonymous compliance line, and then we will address the issue that way. So we give our employees a lot of ways to report if they feel any kind of injustice, they're not being treated properly. So we have a lot of ways to report.
I think that's great. You know, that as the students are watching, I don't know if that's in place in the school, you know, but it's great because it's definitely a need in the workplace, and it's just the next step in life of really kind of.
And we tell a lot of our new employees, you know, we want feedback from you guys. You're new, you bring a fresh perspective and a new set of eyes. And we want your feedback. If you see some things that we're doing that may not be appropriate or may be different, then we ask them to speak up, because we never claim to be, you know, to know everything. We always want to be evolving and getting better. And so we'll take ideas from other areas and implement them here if they make sense. So we encourage our new folks to do that.
Do you have anything?
Yeah, I agree as well. We love to hear from our new hires because they do bring a different perspective, and on the diversity lens, seniority, being new, that's different, that's unique. So we love to hear from our new hires and have for them to have that voice. And we also have different mechanisms, chain of command. Again, that's the HR answer. That you want to follow your chain of command, but we also have anonymous hotlines. You can use anonymous hotline you can use, and if on our badges that hotline is there, so if you don't ever have to remember the number, it's on the back of your badge.
Yeah, that's fantastic. Well, our time is up, and I just want to thank both of you so much for taking your time out to help the community and understand what we're doing and increasing the pathway into healthcare, and really kind of getting them a broader perspective of what that's like. So thank you very much for your time. Thank you for joining us. And we're going to put up the QR code. Please take a moment and fill out that survey, and we'll see you next time. Thank you very much.